Hey guys, this is Dr. Moore with Cumberland Chiropractic and Sports Medicine. Today we're talking about sciatica, or are we? In fact, that's the question for today's video. We're talking about sciatica and some things that are actually sneaky sciatica imposters, some conditions that maybe look or seem like sciatica but aren't. And that's important because if you're doing things at home like stretches or strategies for sciatica that maybe you Googled on the internet, you could actually be making your condition worse if it's actually one of these. So stick around. Okay, so what is sciatica? Sciatica is actually a symptom of back pain that radiates into your leg that's stemming from that problem at your back. The ones that most people are familiar with are like a disc bulge or a disc herniation, or maybe some severe arthritis that's pinching the nerve as it leaves your spine and turns into the sciatic nerve that goes down your leg. So let's say you don't have a lumbar MRI that could clearly show that you have a problem at your spine causing this pain. What are some defining features of true sciatica? Well, if it's coming from a disc problem, it might be that it's really aggravated by bending forward, like flexing your low back, or lifting. It might be worse in the mornings, and it also might be worse, or it might travel past your knee. The pain might radiate down further than your knee, going into your calf or your foot. If it is true sciatica, especially coming from a disc, some of the best strategies for treating this are things like abdominal bracing to keep pressure off of that disc bulge from making it worse, or maybe some extension exercises, some things that we like to teach here in our office. But that might surprise you because if you Google sciatica stretches like I did, you find a lot of hip stretches and things that involve forward bending with your back, which could actually aggravate true sciatica. All right, so we talked a little bit about sciatica. What's our first sciatica imposter? The first one we're going to talk about is called SI joint dysfunction, or maybe an SI joint sprain. What the SI joint is, it's a joint at the base of your spine off to the side where your sacrum, the base of your spine, meets your ilium, or maybe like your hip bone, you might think of it as. What's important about this joint is it has to move, but if it moves too much or too little, it might develop pain. And this pain can radiate down to your leg and seem like sciatica. But what are some differentiating or unique characteristics about it compared to sciatica? Well, it probably doesn't radiate down below your knee. It probably stays up in your glute or your thigh. It's probably made worse when you walk, maybe run, or climb stairs. And then lastly, it might be tender to touch. So if you go out to the side of your spine and touch that joint where that little dimple forms at the base of your back, well, that might be tender, and that might be where the pain is worse. So if your problem's coming from your SI joint, good strategies for that problem are hip and core stability exercises. And it might actually be aggravated by a lot of stretching or extending. So that's like the exact opposite of a disc problem. So it's important to know that. Okay, so another common imposter of sciatica is something called Piriformis Syndrome, or you might hear it referred to as deep gluteal syndrome. What this is it is a problem or irritation of the sciatic nerve, but it's not actually coming from your spine. It's coming from a problem in your hip or the gluteal muscles where the sciatic nerve has to kind of pierce its way through before it goes down your leg. If you start to develop tightness or irritation where the nerve has to get through there, then it will cause pain that runs down your leg, maybe your thigh, maybe all the way to your calf. But it's different because you may not have a lot of low back pain. It's maybe worse in your leg. Some other things that are distinguishing about it are it's probably relieved with hip stretching. So if you get your hip moving, stretch out your hip muscles, may get better. And it's really aggravated by long periods of sitting. So if you work at a desk or you work driving a vehicle, then that might get pretty miserable. And if you have a long weekend or vacation where you're not sitting as much as you're used to, it might get a lot better. All right, so if Piriformis syndrome is your problem, then what we like to prescribe for that are some hip stretches to decrease the amount of tension going on where that nerve has to pierce through those muscles in your hip, and maybe even a sciatic floss exercise to try and loosen that interface where the nerve slides through those muscles. All right, so the last sciatica imposter that we're going to talk about is something called facet syndrome, or a facet problem in your lower back. The facets are little joints in your back that have to glide over each other when you arch and extend. But if you develop a problem in these joints, then you can develop pain in your back that also radiates down your leg. Some things about facet problems or facet syndrome are that it's aggravated by extension or rotating your back. It pinches those joints in your back. It also probably doesn't go down past your knee, and you're going to want to know the difference between your facet problems and your disc problems, because if you go and do a lot of extension exercises at home, it's going to really flare up this problem with your facet joints. Okay, so some of these sciatica imposters trying to differentiate between all of them can be confusing. So what's some good advice? The best advice that I would give is that a lot of these problems, the one thing they have in common is they may be benefited by some stability exercises for your hip and your low back. So if you tried a lot of things and it doesn't seem to be working, maybe shift gears and try that at home. But an obvious disclaimer, if you're doing some of these stretches or exercises or strategies at home and it seems like it makes your back pain or your leg pain worse, stop. You may be doing something that's wrong. Maybe you're not sure what your condition is and you're actually aggravating it. You don't want to just push through this stuff and make it worse and make your injury more severe. But if you find yourself in that situation, maybe you feel like you've tried this stuff, or maybe you've tried everything and you just can't get the relief you need, then why not give us a call? We help diagnose these problems all the time and help patients get the treatment they need to feel better. So until next time, this has been Dr. Moore with Cumberland Chiropractic and Sports Medicine, where we get you better, faster.